Okay. I appreciate your patience. I got stuck in the hostel a bit, and it was a whole thing. Anyways, we'll be going through your first and most important clinical skill throughout your medical college, all the way to year 5. It is the most important clinical skill, history taking. And this time around, for you guys, the grading criteria has changed a little bit. Not the checklist itself, but the grading criteria. In the sense that they don't really care about your data gathering skills as much as they care about your confidence, how comfortable you are and how comfortable you make the patient feel. That is very important. They have a long, I don't know if you guys went through the Word document that outlined every red flag, everything that you should do and you shouldn't do, which sounds like you're trying to tell someone how to be a human. But trust me, like there's so many mistakes that people make. In my students in my batch, in year 4, they make such stupid mistakes and you're like, how is this guy even in medicine? Like, how did this guy get here? And it's not about their data gathering skills, it's just how they're behaving, you know? This is why, like, when you see those lists of how they outline every single point of how to be a human, literally, it's because it's reactive, you know? Because people tend to do this unconsciously. Anyways, let's move on. This is a schematic I saw about 3 days ago. So I'm in pediatrics right now. My clerkship is pediatrics. And I was being given a lecture by a pediatric neurologist. And he said, when I see students in my clinic, and I just want them to take history, right? There are 2 ways they can go about it, or there are 2 scenarios. One is this way. So imagine the path, the dotted line, is your history taking. The arrow is you, and then the bullseye is the diagnosis. Which one do you think they want? So would you rather miss a diagnosis but have the perfect history taking skills? Or would you rather take a messed up path and then somehow hit the diagnosis? Which one do you think they prefer? The second one, this one, they don't care about that at all. They don't want this at all. They would rather you miss the diagnosis. I'm being straight up. You know why? Because the chances of this person missing the diagnosis is around 1 in 10. But this guy literally threw a dart in the air, blindfolded, and it hit the bullseye. If you do this, they will mark you a 1 out of 10. You do that, they'll mark you 9.75 out of 10. This is what I want to tell you guys here today. It's not about your data gathering skills, how smart you are, whether you can recognize the autosomal recessive mutation was in the P arm of the chromosome or in the Q arm. None of that matters. What matters is you know what you're doing, you know exactly what questions to ask, and that you make the patient feel comfortable. Okay? I'm sorry if I'm pausing a little bit. I walked really fast because I know you guys were waiting. Okay. Next slide. Okay, so we had this scenario planned where before we start, we will go through a scenario, me and Mustafa, and we want, how much time is it that they get in the ask you? 10 minutes, right?
10.
You get 10 minutes, right? Do you guys think that's short or long?
Yeah.
And you get a lot of time, right? Especially the fact that it's just pain. You don't have to ask about no associated symptoms, no review of symptoms. You don't even have to think. You literally don't have to think. Just memorize the checklist, know what to ask, and boom. It's a very long time because when you come to clinical years, you have 7 minutes to get the diagnosis right, ask about all the associated symptoms, review of symptoms, know exactly what the diagnosis is, and then discuss the investigation plan and the management plan with the doctor. They gave you 10 minutes because they want you to get comfortable, okay? In real life, you don't get 10 minutes, but you get comfortable. You need to get comfortable with history taking, okay? Sit there, relax, be comfortable, start asking questions, okay? And that's, the doctors, they know your year ones. They'll keep that in mind. They'll not go too harsh on you, okay? They won't give you complicated cases. And I heard this time around they'll not be stingy with the information. So 10 minutes is enough. We have had doctors that, you know, when you go and you're like, you do your introduction and you're like, what brings you to the office? They tell you literally everything that is on the paper. They tell you everything that is on the paper. So sometimes you need around 4 to 5 minutes, that's it. Anyways, I talked for too long. Let's go through the scenario. I should have gone through the scenario, but I didn't. What we will do is we'll go through it together, okay? Whoever is closest wins. Guess the time. Do we have the Buffalo Wild Wing vouchers?
Yes, there is.
Okay. That's perfect. Now, how did we decide we're gonna do this?
I did explain it. Scenario one
Uh-huh.
for the migraines.
We're gonna put it in the end when I'm the patient.
Okay.
Okay? But no, guess the time. How are they gonna guess the time?
On the bed.
We gave them.
You all got papers, right? You guys already wrote it?
Yeah.
Oh, mashallah, you guys are efficient. That's nice. Am I the patient or am I the doctor? I think I'm the doctor, right?
For this one.
Okay, I've not gone through the scenario. So, go through it with me. Look at the time. I'll not look at the time because I'll make you nervous.
It's just
But yeah. Do you have the scenario with you? Are you be reading through it or are you preparing? Okay, cool. Have you read through it before or no?
I've read through it really quick.
Okay. You guys practiced this before, right?
We had 3 sessions with the
3 sessions, but did you guys practice at home?
No.
Okay, that's perfect. That's why we're here. We'll let you know exactly what to do and how to do it. Okay?
If someone just presses the.
I will be skipping through the associated symptoms and review of symptoms because that's not what you guys are here for. Okay? In your PowerPoint, it's very clearly written that it will be covered in later years. So I'll not be going through it, so just keep that in mind. Okay? No. I'm just saying in general, clarifying to them that this is not how I would take history in the hospital, but rather how you should take history in your exam. Okay? Okay. Sorry.
There's a question, right?
Yes, go ahead.
I have a question, yeah.
Mhm.
Within the checklist, we have to ask about the associated symptoms and the IMP.
Okay.
But
So,
just like 2 questions.
yeah, there was some confusion there. I talked to Mustafa about it. If you can ask 2 very simple questions, that's fine, just run through it. But in real life, associated symptoms, it can get longer, you know, it's a review of systems. I'll try to do that as well, okay? I'll show you how, in what circumstances of pain, what you can ask. Okay? Do we share the mics? Okay, I guess we just share. Yeah. Hello, my name is SamiuIlah Haroon. I'm a year 4 medical student. I was sent here by my senior doctor to ask you a few questions. Is that okay with you? Is this room in general private enough for you? I would like to assure you before we move on that everything that will be said and done here will stay between me, you, and my senior doctor. Do you wish to proceed? Okay, so what is your good name?
Mr. Tom.
Mr. Tony. Okay, and how old are you, Mr. Tony?
55.
55. Okay, if you don't mind me asking, what do you do for a living?
I'm an engineer.
Okay, I see. So, what brings you to the clinic today?
I have some pain in my big toe. It's been annoying me for a while.
I see. Is that the only concern you have?
Well, this pain, it's been annoying me, especially at night. I just wake up randomly, sometimes at night, just because of this pain.
Okay, I see. Can you tell me when this pain started?
It started almost maybe 2 weeks ago.
Okay. 2 weeks ago, I see. And did it start gradually or was it like sudden?
Well, the first few nights, it was just sudden, and then it started being, increasingly more.
Okay. I see. You did mention before that the pain occurs more at night, right? But I would still like to confirm, since the pain started, has it been continuous, or does it come and go? Or is it just at night and it gets worse at night?
It's sometimes throughout the day, but it's mainly at night. Really great at night.
Okay, I see. No worries. When the pain first started, was there anything that you were doing out of the usual?
Well, I just had a great meal the night before sleeping, and most of those days I had this pain.
Okay, I see. No worries. Can you tell me exactly where the pain is? Can you point at it?
It's right around.
It's right around there. Okay, I see. Does it go anywhere else, or does it just stay there?
No, just stay there.
Stays there. And it's only on that side, right? It's not symmetrical?
Yeah, it's just this side.
Okay. I see. Would you be able to describe this pain?
What do you mean?
Like if I was to give you examples of descriptions, is it a dull aching pain, or a sharp stabbing pain, or a prickling, numbing sort of pain? How would you describe it?
I think it's more like I could say sharp pain, and I feel like sometimes it's pushing outwards. It's like throbbing.
I see, that must be hard to deal with, okay? How bad is the pain?
It gets really, really bad at night. I wake up at night just completely out of pain.
Well, I'm sorry to hear that. So if I was to give you a scale from 1 to 10, 1 being very mild, and 10 being the worst pain you have experienced in your life, what would you rate it?
At its worst, I think I could say it's easily a 9 out of 10.
Okay, I see. Does this pain come with any swelling?
Yes, it does.
Okay. Any redness or warmth as well?
Yes, especially again at night, it gets really red and really warm.
I see. Okay, so what do you think caused this pain?
Honestly, because of this, the meal that I had at night, I think it might have caused it. Just for those few days that I especially had great pain and.
And what concerns you most about this pain?
I'm just scared that because of this pain, I cannot move around easily, and so I cannot go to work, for example.
And I see, what do you expect from us other than treatment?
I just want to understand exactly what I have wrong with my big toe and how I can solve it.
I see, it has been affecting you bad, right? You said that you were not able to work and so on. Okay, I'll just ask you a few more general questions just so we make sure that we don't miss anything. Have you been experiencing any fevers? Any weight loss? Any fatigue more than usual? Any unintended weight loss? Like you said, okay. Great, can you tell me if you have any long-standing illnesses?
I do have high blood pressure. It's been around there for a while.
I see, and when were you diagnosed? Or were you diagnosed for it?
Yes, about 8 years ago.
Do you have any other long-standing illnesses?
I was told before that my uric acid levels are very high, but no one told me that it is a big deal.
Okay, I see. So, have you had any surgeries performed on you in the past?
Yes, I did. I had a hernia repair.
Okay, so was the hernia repair complicated? Like, was there anything that happened around this time of the surgery?
No, it was a simple surgery, in and out.
I see. Do you take any medication for your high blood pressure or any other medications in general?
Yes, I did take amlodipine for my blood pressure, but otherwise I only took some painkillers for this pain. but nothing else.
Okay, and do you have any allergies to any food or medication? No. So, is there anyone else in your family that has experienced some sort of like similar pain?
My brother did have a few years back a problem that's very similar to mine. They told him it was gout.
I see. So, does anyone in your family have any other long-standing illnesses?
No, it was just my brother.
Okay, I see. Now I'll be asking you a few questions about your social life, if you don't mind. Do you smoke, Mr. Tony?
Right now, no, but I did have some history of smoking.
Can you tell me what you smoked and how long you smoked it for?
I just smoked cigarettes. I smoked it about, I stopped 5 years ago. It wasn't a long period, maybe 2 years.
Could you give me an average of how many cigarettes you smoked a day?
I'd say 1 packet a day for those 2 years.
I see. Okay, you said you're an engineer, right? So does that come with any sort of work-related stress?
No, not really.
Do you consume any alcohol, if you don't mind me asking?
Yeah, sometimes I have on the weekends some beers with the friends just to relieve some stress.
I see. So can you tell me how long you've been drinking for?
For the past maybe 6 months, I've had this habit with my friends.
Okay. Can you tell me if you perform any sort of physical exercise or if you're physically active?
No, for the past few years, I'm not very active, to be honest.
I see. Okay, so just to summarize, you said you have had this pain in your big toe that also came with redness and warmth and some swelling, and you said it has been there for about 6 weeks, and it started gradually. It comes and goes, and it's worse at night. Yeah, 2 weeks. I'm sorry. So, other than that, you said you smoked as well, but then you quit, and you drink casually with your friends on the weekend. Is there anything else you would like to add, or that I missed that you would like to mention?
No, not really.
That is it. Okay. Thank you so much for coming. I'll report these findings back to my senior doctor, and we'll get back to you, inshallah. Okay. Thank you. Okay, just one thing. I noticed the time in the end. It took very long, but trust me, it does not take this long. I think it took this long because we were sharing the mics and we were very slow when I tried my best to talk slowly as well. I don't talk this slowly in real life. Anyways, who guessed? Let me see the paper. We're trying to get the closest time. I didn't expect it to go this long either. I didn't expect this to be this many positive findings. There was literally everything was yes. Okay, 10 minutes is the close. Someone wrote 13 minutes. Okay, we have a closer one, 9:36. Someone guessed 9:25. Abdullah Saeed, who's that? Nice, mashallah. Good on you.
But it stopped.
Huh?
The timer stopped for 20 seconds.
Oh, it did?
Yeah.
How come it stopped?
It was internet connection.
Well, it is what it is, you know. It was in his nasib.
Not fair.
When it stopped, when it came back,
They counted.
Okay.
It's in his luck, to be honest. In his nasib. Abdullah Saeed, he gets a voucher, I guess.
Congrats, everyone, clap
Good job. Okay, now I'll be going through what I was thinking while I was taking this history. And I'll give you some key points that you should really focus on, especially for your first history taking. Okay, so Bismillah. Okay. So I have something called the rule of double three. This is something that I personally do, and it has helped me immensely. Like, I have never thought about, oh, I'm going to miss something in the intro, ever, because I technically have these things memorized. Hello, my name is Samiullah Muhammad Haroon. I'm here for medical student. I was sent here by my senior doctor to take your history. Is that okay with you? Is this room in general private enough for you? I'd like to assure you before we move on that everything that will be said and done here will stay between me you and my senior doctor. I have this memorized like the back of my hand. When I'm saying this, I don't think at all. When I'm saying this, I'm thinking about other things like, okay, who's the doctor? What do you think the case is? This is basically a time for me to relax because I have memorized like this, like the back of my hand. And I have never missed it since year one. There's people to this day in year 4 that are missing this because they go with the flow. This is not something that you have to go with the flow with, like, it's very basic questions. Memorize, move on with life. I have written it over here, everything that I just said, and I memorize it in this exact way, okay? And this also applies to physical examination. When you move on, it is literally the same thing. So instead of asking you a few questions, it's going to be everything that will be done here will stay between me and Malak. It's very standard. Memorize it. It will help you for the rest of your life. Okay? That was the first 3. Okay? It was consent, confidentiality, privacy. Now it's called the rule of double 3 for a reason. Now there's a second 3. Second 3 is you asking the question, the introductory questions, building a rapport. Okay? Making them comfortable. Which is, what is your name? You can ask it in a good way. What is your good name? How old? Here, what I do is once I know the patient's name, I like repeating it again. He said, my name is Tony. I say, okay, how old are you, Mr. Tony? When you repeat it once, it kind of engraves into your mind. What I also like doing is I kind of write it down because sometimes things like these, you get in a lot of trouble if you forget. Like here, I forgot the time that it took, the onset and the duration of the patient's pain, which I usually like writing down because there's numbers going on and so many things. And this patient, mashallah, he had every social history and everything positive. So yeah, I messed up over there. You should be writing numbers down, especially, okay? Sometimes you can forget. We're all humans, you know. None of us are perfect. Okay, I was at name. What is your good name? How old are you, mister? And what do you do for a living? Occupation, I have in your checklist, in your PowerPoint, it was written that you ask it near the social history. This varies from time to time when I'm in the hospital. Sometimes I'll ask it in the end if I have the time, when the patient is in distress. But usually I like asking it over here because a lot of the times, especially in real scenarios, even hatta in fake scenarios, okay? The occupation is very important. It is usually related to the patient's complaint because that's what they're doing for more than half the day. More than half the day they're at their work. So it's going to be related. But sometimes it can tip you off and give you the wrong diagnosis, which happened to me. And then this is how I like asking it. Okay, go back. This is how I like asking it. And you'll see this theme in my next slide as well. You can ask it in whatever way you're comfortable asking yes.
Do we get a notepad with us when we're doing the exam?
So you'll not get to take a notepad with you. It will be when you go into the office, the station, you'll have a seat, you'll have a notebook, and you'll have a pencil next to it. Okay?
They give us the...
Yeah, it's there. It's there. Okay? This is for their privacy reasons. They don't want people going out with the history taken down, you know, they're very strict about these things. You can't have anything on you when you're going to the stations, to the asking. So, yeah. Now we start. We're done with the introduction. There are so many ways you can start. And they want you to be vague. But in my honest opinion, you can't be super vague. You ask the patient, how are things? You know what majority of times the answer is going to be? Alhamdulillah. How are you doing? Alhamdulillah. This is, I have literally seen people ask this in the hospital. How are you doing? Allah, alhamdulillah. And this guy's in distress, he's literally in pain. Alhamdulillah. Like, you can be vague, and you need to be vague, but not this vague. Like, come on, okay? Like, this is a rhetorical question, in my opinion. You know, when sometimes I ask my friends, how are you doing? I don't even expect a response. I expect them to say, alhamdulillah, how are you doing? You know, we don't even think about it. So I don't want that to happen. Just, how can I help? What my personal favorite is, what brings you to the clinic / the hospital today? It always works, very standard, boom. Very, very important, never, ever, ever, ever interrupt them. You are not only going to lose the mark, but this is the beginning. Once you leave a bad impression over here, you're nervous, you ask about something, it's going to go wrong. You're going to miss the marks, the patient's not going to respect you, nothing. I'll give you a very funny scenario that happened a few weeks ago. So, I was in the hospital, I go into the patient's room, I have the nurse introduce me, and I'm like, is the patient there? I ask the nurse, she's like, yeah, they're down, just got done with the x-ray, they're there. I go in, so there's two seats, there's the bed, the patient's bed, and there's the relative's bed, where they sleep. I don't know if you guys have been to the hospital, usually. And then there's a seat next to it. There's a person sleeping on the relative's bed, and then there's a person sitting on the chair next to the patient's bed. There's no one on the patient's bed. So I'm like, wait, who is the patient? I asked them, like, wait, which one of you are the patient? They're like, this guy. And at this point, not at this point. Okay, so I asked the patient, and I'm like, hi, how are you doing? Everything. I introduced myself, and I get to the second three questions. I'm like, what's your name? What's your age? At this point, my friend knocks in from outside. He's like, Samiullah, we gotta go. The doctor's calling us. It disrupts me a little bit, and I'm like, I look at that. I'm like, okay, where was I? Okay, I have to ask. Now I have to start. I start, and I'm like, okay, so what brings you to the clinic today? The patient goes, I had a fever that started gradually about 2 weeks ago, and it has continuously stayed. I hear this. This is not how a civilian talks. This is not how a normal person talks. And my mistake was I was so shocked. At this point, also my friend, he's there outside waiting for me. He's like, Samiullah, we gotta go. I'm like, wait. What do you do for a living? He's like, oh, I'm a doctor. Even though this was like, oh, he's a doctor, I gotta change the way I approach this and kind of put some stress on you because you're taking history from a doctor. He's gonna judge you, But then I interrupted him. It doesn't matter what the case scenario is, you should not interrupt the patient at all. It doesn't matter what he's saying. You let him continue. Unless he's bipolar and he keeps on going, you don't interrupt him. This is not a psych interview, okay? You should always let him finish. And in your checklist, there's something extra there, like you have to kind of ask him to keep going, which is not there at our times. But I kind of adapted it. I don't know if you guys noticed. I asked the patient a question after his initial complaint, which is good. If your F2s have the checklist in front of them, they're like, oh, they're supposed to ask this, they might give you extra information. So very good for you guys. Ask it. No. Okay.
Okay, so now that we know what his chief complaint is, we have to know exactly what is wrong with him to diagnose him. One of the first questions that we should ask should include the onset of this disease or this complaint. There are multiple questions to ask about the duration and the onset of the complaint that the patient came with. They could be summarized into 5 main ones. The main one would be, the first one, would be, when did the symptoms start? This is the big one. It's always the first question to ask. So this can help decide whether this is an acute or chronic disease. Why does this matter? Does anybody know if it's acute or chronic?
It's an emergency if it's acute.
Yes, exactly. So if it's an acute disease, it would appear, for example, 3 hours ago, for example, or maybe 2 days ago. This is acute. Or for example, came in with a broken bone or a dislocated shoulder. He would say, I just came, I was playing football, and I just came from the field because I fell on my shoulder. You have to treat him very quickly because this is considered acute. This could also be a broken shoulder or a broken arm. So you have to decide what to do with the patient from this question. The next question should be whether it was sudden or gradual. And then you have to ask the patient what he was doing at the time of the start of this pain. Again, as I mentioned in this example, someone was playing football, he fell on his shoulder. This gives you already so much idea about what's going on. This could either be, this is majorly trauma. If it was something more like after eating peanuts, or after smelling perfume, or after anything such as this, allergy. absolutely, right away it pops into my head. Of course, this now doesn't matter much because you're not going to diagnose now. However, as you set up for the history taking, this is going to matter so much, inshallah, in the future as you go through medical school. So these questions will clear up a lot already from just the first point in the checklist, already clears up so much about this disease. You can also ask about whether it became better or worse. This is classified as progression. In our year, we had its own point in the checklist, and now they added to when. The last question is it continuous or does it come and go? Again, there are diseases, for example, they come at night. So for example, the case that we just had, gout, it increases at night. There are some other cases, for example, rheumatoid arthritis, osteoarthritis. They appear a lot in the morning once someone wakes up. So again, this clears up a lot sometimes from the disease. You can also ask, how long does the episode stay? For example, in rheumatoid arthritis and osteoarthritis, now I know you didn't take MSK yet, but once you take it, you'll get to know. For example, rheumatoid arthritis stays for, I think it was 1 hour?
More than 30 minutes.
Yeah, more than 30 minutes. However, for osteoarthritis, it stays less. So this already clears up between two major diseases that you had in mind for a dark differential. So now you know when the pain started, how long he's had it, how long the episodes are, if they were episodes, if he had it before or not. You can now ask where the pain is. And you have to ask it, first of all, he came in, he already told you I have pain in the wrist or pain in the big toe. For example, in my chief complaint, in this example, I already told the doctor and I have pain in my big toe. So from that point on, I have to know exactly where. مثلا, someone comes in, he tells me I have chest pain. But if the chest is very big, it could be in the heart, it could be in the lungs, it could be on the right side, it could be, for example, in the back. The back also is a very huge area of the body. So we have to know exactly where there is. If it was, for example, lower chest, it could be, for example, a liver disease or a gastric problem. If it was in the middle, it could be heart. Or if it was on the right side, of course, it could not be the heart. Then most probably either MSK pain, so something to do with the muscles, the ribs, or maybe the lung. And after you you ask the patient where the pain is, you ask him to point at it. Now, while you will not really, again, care much about it, some very important note is that at least try to show the patient, or the doctor in this case in the exam, that you care. So what you do is you lean over, if for example, he was sitting in front of me, there's a table between me and him, I lean over and I see, okay, this pain was in the side, the medial side, for example, of his knee, he came with knee pain. Show the F2 or the doctor, the examiner, that you want to know where the pain is. And then a very important question is it on both sides or one side? A lot of us used to forget it when we were in your place. I did it once by mistake pretty much during one of the formatives, and the F2s, the examiner, he told me, yes, this is a great question to ask. And later on we again knew in MSK that the very two diseases that I would confuse them and many others would confuse them, they would be differentiated with this question. Rheumatoid arthritis, because it's systemic, it's on both sides. Osteoarthritis is on one side. This is just an example. There are many other examples that could come up with this. It could be a nerve problem, so you would know whether it's in the spinal cord, if it's on both sides, or if it's on one side, it could be something that's in the peripheral nerve rather than the spinal cord. And then one other important question is, does this pain stay in its place or go anywhere else? Can you give me any examples of pain that can go anywhere else? Nerve pain? Generally, yes, it is due to nerves that intersect with each other or are shared between multiple organs. If I ask you for a specific disease, for example.
Like during a heart attack?
Exactly, during heart attack, If you can tell us where would this pain radiate? Yes, exactly. To the shoulder, to the left jaw as well, and sometimes a little bit to the abdomen. So this is an example. If it was lung pain, for example, it would not radiate. So this already removed one of the differentials that I had, one of the diseases that I thought was the cause. I removed it with this question. So this could absolutely help.
Before I go on to quality and quantity, there is a bit of a bonus question that you can ask. Not really required from you, but if you can write it down, put it in the back of your mind, in case you get a doctor that doesn't really know the checklist. If a patient comes with fall, okay, I'll give you the scenario that I had in year 1, semester 1, okay? Patient came in, elderly woman, fell on her hand, and broke her hand, and that was the whole history, okay? I asked everything according to the checklist. In the end, the doctor told me, you did very good, mashallah, full mark, but I'm still disappointed in you. You didn't ask something very important, which at your level, you're not supposed to know, but logically it makes sense. If someone falls, you need to ask about head trauma. Any fall whatsoever, ask about head trauma because it's very important. They're studying it right now in year 3, so they would know the importance of it, but it's like a bonus question. If you ask it, the doctor will be like, okay, this person he's good, you know, he knows what he's doing. So keep it in the back of your mind. But it's not really in your checklist, and you're not going to be penalized if you don't ask it. Moving on to quality. It's very easy. Can you describe the pain for me? And like, they'll either describe it for you and you move on with life, or they'll be like, I don't know what you mean, can you please give me examples? And then you can give like 3 examples out of the 2,000 that there 2,000 types of pains that there are, okay? Then quantity, this applies mostly with pain, which is what you're dealing with. How bad would you say the pain feels? You have to make it open-ended, right? And then if they either say, oh, it's really bad, or I don't know what you mean, doctor, give them the scale, okay? 1 to 10, describe what the scale is, easy. Next. Oh, by the way, just move up. So there is a point in your checklist where you have to show empathy. Funny story, so I'm an optimizer. What I do is, I have a goal, and I'm like, I clarify the goal. What is the easiest, fastest, and most convenient way for me to achieve this goal? The goal is to not show empathy, to get the mark for the empathy. So initially, I did this for 3 years. How I would show empathy is, patient comes in, I'm like, what brings you here today? As soon as their first complaint, I'm like, I'm so sorry to hear that. I see the doctor checking off the empathy form, I'm like, khalas, we won't. And this worked till year 4. Up until I went to the hospital and the doctor, I said something like this. So there was a stroke patient, but they didn't really know they were having a stroke. And they said, oh, I have a weakness here. And I was like, I'm so sorry to hear that. The doctor's right next to me. He's like, what are you sorry to hear about? It's not that big of a deal. Don't make the patient nervous. What's wrong with you? And I'm like, okay, wow, what I was doing was completely stupid. So you realize things as you move on, you know? You're not going to be perfect from the first semester. But I got the marks. But I would really, I suggest you don't do that, okay? Don't be an optimizer. Or at least be an optimizer in the correct path. But in the quantity, it's a very good spot to show empathy. Right? If the pain is like 4 out of 10, you're like, I'm so sorry to hear that. Doesn't really work. If the pain is like an 8, you're like, that must be hard to deal with. Sorry, you must be going through a hard time. You don't really have to say, I'm so sorry to hear that, because that's what 90% of the people say, but there's other ways to show empathy, and this is a good spot to show it, but it has to be situational, right? You adapt according to the scenario. That's your points for empathy. Don't forget it. It always has a mark. It's always there in the checklist. Yeah, make sure you don't forget it. Very easy. What makes the pain better? You have to remember it, wakabi, and they'll just tell you everything. Next. Aggravating. What makes the pain worse? Nothing to say about it. Just have the questions in mind and make sure you say them. They're not that complicated. Covered in later years. But someone did say that they have to do like 2-3 questions, and Mustafa will talk to you about what you can say.
Okay, so as SamiuIlah said, as you said, as the slide said, it will be covered in later years. However, I asked some of you, you did cover them in your labs. So I'm just going to go over them really quickly, just so you have them in your checklist if it was there. Associated symptoms, again, the chief complaint comes in. Of course, it's not going to be enough. Someone comes in with chest pain. Sure, I have his onset, I have his exact area, but I don't know exactly what it is. What I would use is the associated symptoms, because each disease comes with a different set of symptoms. It could be, for example, if he doesn't have fever, it would be maybe damage or trauma. If he has fever, it could be something more systematic, like an infection. That's an example. If he comes, again, you can ask, just as SamiuIlah said in some other parts, you can ask a general question, an open-ended question, so that you give the patient the freedom to say what he wants or what he has. If he doesn't have any idea, for example, or he says that no, it didn't come with anything, then ask him, start asking. If he has fever, if he has fatigue, if he has, for example, night sweats. And in your cases, they usually want you to ask things that are more related to the pain that you have. So for example, if someone comes in with wrist pain or knee pain, those are all joints. So some of the examples or some of the consequences that could happen from an inflamed joint is, I mentioned them here, they are redness, swelling, heat. Redness you could ask for with discoloration as well. You can also ask for loss of function. So if he cannot move his wrist, if he cannot move his arm, if it was a wrist injury, or if he cannot move his leg, if it was a knee pain, you can always ask those. You can also ask about headache. If he comes, with a headache itself could be an associated symptom. If he comes with headache, for example, you can also ask about visual disturbances, nausea, vomiting. Generally really open or general stuff that could be seen with a lot of diseases. But again, try to aim for something that is most closely related with the chief complaint. Again, it is covered in later years in more detail. So later, inshallah, when you become year 2, you're going to cover maybe CVS, RASP. In those, you're going to have to use a lot of this to, for example, for us, we are in CVS, RASP. When they give us a case, we don't know whether this is cardiac or respiratory. We will use this, the associated symptoms, to know what the case is. Is it respiratory? Is it cardiac? This is the thing that's going to play a big part later on, inshallah. But for you, it's simple. Now we're done with the wakka. Now we'll go on for the beliefs. The beliefs consist of 4 main components. They could be abbreviated with I's. Ideas. First of all, as SamiuIlah asked me, what do you think caused this pain? Again, if, for example, the patient comes in and I ask him, you remember the question where I asked, what do you remember you were doing when this pain started? If he doesn't remember anything, you can ask him this question and something might come up in his mind, maybe not at the time of the start of the pain, but a little bit before. For example, as I said, someone playing football, he fell, he got injured, but he didn't feel any pain. Again, maybe most of you know about the adrenaline and how someone doesn't feel pain because of adrenaline, so he doesn't feel about it. Once he comes back home, he's going to start to feel this pain. And it might with use, for example, if he hurts his foot, he walks every day, he has to walk. So after this exaggerated use of his foot is going to increase. He's going to go to the hospital, you're going to ask him, what do you remember? Or you're going to ask him if this pain started suddenly or gradually. He's going to say gradually, because it's with use. But once you ask this, what do you think is the cause of this pain? It will clear out again a lot from the cause of this pain. Concerns and expectations and effect on life, it's mostly to create a repertoire between you and the patient, to gain trust, to gain his trust, and to know that you sympathize with him and that you want to know more about this pain and you care about it. So the concerns, you ask about it very easily. What worries you about this pain? For the expectations, it's not really important to us, but it's better to ask away from treatment what they expect from us. In the case that we had, the patient wanted to know exactly what he has wrong in his body. Some other patients, one of my F2s, they told me that when she was a doctor, a patient came up to her and she was about to give her drugs and medications, and the patient said, "No, I only want sick leave and I just leave." So this could be one of the things that should be covered during the beliefs section. Effect on life. Some patients come in, of course they have work. This is going to be the most common answer. I'm afraid that this is going to affect my life, my work. I cannot, for example, if he comes in with wrist pain and he works a lot with the mouse, for example, an accountant or an IT specialist, it's going to affect his life greatly, especially if it was in his dominant hand. So you have to ask this question to feel more human with the patient and to sympathize with them.
Review of symptoms, again covered in later years, but I want to take my time with this one. I'll tell you about a story. So, around a year and a half ago, there was an elderly woman that had sudden onset diabetes and gastric reflux, okay? So typical symptoms of GERD and diabetes, seemingly unrelated. Went to the doctor, the pain wasn't getting better with PPIs, the medication that they give for GERD. Just kept increasing the dose. And she missed some very critical review of symptoms, the doctor missed some very critical review of symptom questions. And that delayed the actual diagnosis, which was pancreatic cancer. Because of how aggressive the pancreatic cancer is, she got diagnosed 2 weeks later, and she ended up passing away because of it. I want you to memorize these constitutional symptoms, even though you're not supposed to right now. You're supposed to go through a few things, joint pain, muscle pain, whatever, diarrhea. You are never supposed to miss this. Fever, weight loss, fatigue, night sweats, loss of appetite. If you end up missing them, you can cause big harm, okay? But again, at your level, it just happens in the back of your mind. You're not supposed to miss these things. Of course, if a patient comes with fever, you're not supposed to ask him, "Oh, I asked you about fever, but do you have fever again?" No, use your brain. If you have symptoms, you only go through it if it's one that like you don't think it's related, but you just want to cover your bases, you know? These 5 are the main ones. Of course, these are not the only ones, right? These are the constitutional ones that are constitutional symptoms that I want you to memorize like the back of your hand, and I always have them ready. When you have this mental, a lot of the times in the review of symptoms, students get mental block because of everything that they went through and associated symptoms as well, and they're thinking about the diagnosis. They forget what to ask in review of symptoms. But these ones, I would rather you memorize them, okay? This is, the resolution is very nice, but this is a general checklist of the review of symptoms that you can ask. Right now, you don't need to. Next, please. Then you go on to the medical history, okay? Very simple questions. I'll try to hurry it up because there is another part of this where we'll have some of you volunteer for prizes and we'll judge you. Okay, so have you been diagnosed with this condition before? Very simple. Do you have any long-standing illnesses? We want to rule out stuff that might be related to it. So in this scenario that just happened, the patient had gout, and there are certain medications certain medications for hypertension, which is also what this patient had, that can cause gout. Thiazide diuretics and so on can cause gout. So it is very important to keep these things in mind, because things can be related, right? Diabetes, strongest risk factor of MI. So when the patient comes in with MI, you want to rule those things out so you can control those factors as well, not just give morphine or whatever. Yeah, do you have any long-term medical conditions? Have you been hospitalized before? Or have you had any operations performed on you? Very simple questions. You ask them, memorize them, and move on with life. Next. Family history. So long-standing illnesses, first of all, sometimes it's an infectious cause, and you ask if, okay, has anyone else in your family been suffering with the same thing? Or if it's something like meningitis that we don't want to spread, you know, we start giving prophylaxis, and so on. We want to treat those people as well. If it's STIs, we want to treat the partner as well. Otherwise, it's not going to solve. It's not going to get resolved. Sorry. That's an important question. Anyone else in your family been suffering with the same condition? Anyone in your family? Does anyone in your family have any long-standing illnesses? Now, one thing that I forgot in my history taking here was asking for the health of the parents. And when you have senior patients, you can't just, of course you know it, that their parents are probably not alive, right? But you don't ask, are your parents alive? That's rude. So what you do is, you can ask, it in a nice way, how is the health of your parents? Even though you know this guy is 79 years old, parents are probably not in this world, right? But you ask it in a nice way, it's manners. How is the health of your parents? And then they will go on about it. Oh, my dad, he passed away about 6 years ago. You go into details, like, can you tell me, if you don't mind me, like, what did he pass away from? Either they're going to say natural causes or stroke, MI, and then you check at the age, right? Because these things, they can be genetic, they can pass on to this patient as well. And we would want to either help that information, help us diagnose this patient, or we want to prophylact, right? Because they're at higher risk of these conditions. Any other long-standing illnesses in your family? Hypertension, diabetes, and so on. Very strong genetic factor. Okay, so we want to rule those out. Okay, next. Oh yeah, sorry. I'll just get the slide back, huh?
Hi, thanks, SamiuIlah. You stole my part. Please steal more.
I didn't even know it. I'm sorry.
Okay, it's fine. No, you did a great job. So now for the social part of our history taking. Now, there is one important point that we did not write, signposting. With each section, you have to tell the patient, okay, Mr. X, now I'm going to ask you a few questions about, for example, before the medical history, now I'm going to ask you a few questions about your medical history or about your family history. In this case, our F2s and our batch, they did warn us from asking about the personal or private life, because using those words, it's sensitive. If you're gonna ask someone, I want to know about your private life, of course he's gonna say no. So the easy way to ask it is, now I'm going to ask you about a few of your habits, for example. Now, starting with the social history, again, we signposted, we told him, we do not ask, by the way, because you already asked for consent in the beginning, you're only going to tell him that, okay, now I'm going to ask this question. Now, the social parts, they could be memorized with snaps or S-snap, whatever you like, and in whatever order, as long as you cover them all. So smoking is probably one of the most important social habits that is actually pretty common, and we saw it in our case. You have to ask about smoking, and if he says no, even if he says no, you have to ask if he ever had a period where he smoked before. You have to ask about the length of this period, how long ago it was, and what he smoked. Now, why is this important? Of course, we have cigarettes, we have vapes, we have e-cigarettes, we have marijuana. Of course, in some parts, in most parts, it's illegal marijuana, but in some parts, it might be. But in general, you have to ask about what he smokes exactly. And the last question, some F2s would like you not to ask it, but most of them do urge you to ask it. Do you plan on quitting? Now, this might come as a sensitive question. However, you can ask it, no harm. After all, it is an examination, but keep that in your mind that some patients, if you ask them, if it was something, for example, MSK related, so he broke his hand, and you ask him, do you plan on quitting? He's going to tell you, why do you care? Smoking did not cause my broken hand. So some patients will feel sensitive to this, but you can always ask it in your history taking. After finishing smoking, you go to nutrition, SM. I forgot it in my examination because I wanted to finish the smoking and then alcohol, PTSD, but for the nutrition, you always ask a very general question, describe your diet for me, or what is your diet like? If it was something specific, you can ask about more details, but asking for the diet in general should be enough. So for example, if he comes in with fast food or a keto diet or vegetarian, if you remember from foundation, there was a disease related to vegetarians. What was it? Does anybody remember? Anemia, yes, exactly. Megaloblastic anemia. Again, this could be one of the questions that can help. In our case, actually, we had gout, and the diet was meat. He eats a lot of meat, red meat. So it always raises up the diagnosis for you. Alcohol is very similar to smoking, as again, the same exact questions. Do you drink alcohol? How long ago if you haven't? What do you drink? And etc. Physical activity, you ask for it and how frequent this physical activity is. So for example, if he comes in and he says, oh, I play football. I brought up a lot of examples for football. Do you play football, for example, and how frequent do you play it? So maybe once a week, once a month, makes a difference sometimes. And stress, again, this could lead to diseases like atherosclerosis, like hypertension. This will always ease up the diagnosis of those two. And in general, again, it's to make the patient kind of your friend. You want to make him even less stressed when he is with you. Talk to him as a friend, create a repertoire, as I said, just like the ice. And now moving on to the summary with Samir.
A lot of students usually have questions about the summary because they don't know what the positives are and what the important negatives are, and they sometimes use jargon because they explain it like they're explaining it to a doctor for some reason. Important positives like the pain itself, the characteristic, the rating, whatever the patient told you that you think is important, right? Important negatives, you guys don't know what the important negatives are because you guys didn't study it. So if I was in your spot, I wouldn't really focus on this. Like if I was you, I would not mention anything as an important negative because they don't expect you to know these things, right? There is a mark on you asking if you missed anything from the patient, right? You summarize, you're like, would you like to add anything? Did I miss anything? Just say that and you get the mark, okay? Make sure you don't forget this. This should always be in your mind, okay? Closing statements, they also have a mark. Thank you so much. I appreciate your time. And if you have, I'll report these findings back to my senior doctor and get back to you. In the clinical scenario, right, when we're in the hospitals, it's a bit awkward because a student just came and asked you a bunch of questions, you don't know what he's going to do with it. You can kind of service them a little bit. This is further on in your career. It can be like, if you have any concerns or any requests you would like me to relay to the senior doctor, let me know. Because then you're doing something for them because they just gave you a bunch of their time, which they don't really need to because you're just a student going around doing nothing. So try to service them as well, right? Be of use. Okay. I think better we skip this because it's better if we get the volunteers.
No?
Yeah. Well, we'll try to have the same scenario because it's taking too long. We had the scenario where we try to like purposefully make mistakes and have you guys tell us what mistakes we did. But I feel like you guys are all about to sleep. So what we'll do is we'll have someone, a gentleman or a lady, come volunteer. Yeah, you guys have rewards. You guys get you guys get these Buffalo Wild Wings vouchers. Yeah. The first scenario is going to be me. Okay, so I'll be nice. I will try to remove as many negatives as I can. Okay. You're the doctor.
Yes.
Yes. You are the doctor. Yeah. I'll give you a case that came in my OSCE about 3 days ago. Okay? but it's related to you guys. It might actually just come for you guys because there's no associated symptoms or nothing really important, nothing in the review of symptoms, and I'll try to have you guess what it is. Okay? I'll try to be loud. You have the mic. Okay? How is that? You want a paper or a pen? Sure.
Do you have that as an exam?
Yes, you do.
You have a paper and a pen?
Yes.
Okay. Well, why do you need that?
So you don't forget stuff.
So we can write down during the exam what...
You can, but you don't have to you can't just look at the notebook the whole time and be like, okay, and you just talk.
No, you have to be respectful to the
Yeah. So just look at them and then your age, okay, write it down. Name, pass, whatever is important, you write it down.
Okay, we'd love to.
You guys can hear me, right? Okay. I'm usually very loud. I'll make it like for you. Oh yeah, so bonus for you as well. We will try to do a feedback session after this. You'll have to tell me what you did well, and try to make it as much as possible, and then what you could have improved on. Okay? So pay attention. I'll ask randomly.
So just to clarify, I'm not prepared in this, so there are a lot of things I don't know.
That's what we want.
Yeah,
That's
okay,
what we
so-
want. Because nobody's prepared here, and we want to target the common mistakes.
Yeah, and it's like for revision, man, so I can remember better.
Yeah. Note stuff down that he's doing wrong or he's doing well. Okay? Because you will forget as well.
Thank you so much. Okay, Assalamu alaikum. My name is Mustafa. I'm a junior doctor. Can I get your name first?
My name is Samiullah.
Okay, so first of all, I want to get your permission. Do you mind if I ask you a couple of questions related to the case? Okay, so is this room private enough for you? Do you have any kind of request that you want me to do right now? Okay. Do you have your consent to ask not private question, but just no questions right now?
Okay, yes.
Okay. So could you tell me what made you visit the clinic today?
So I've been having, you guys hear me, right? So I've been having this
You can
pain.
like just go ahead so we can hear better. Okay.
So I've been having this pain in my on my head, and it started about 4 years ago,
Okay.
right? Yeah, that's what I'm here for today.
Okay, so can you tell me, you told me that started like 4 weeks ago, right?
4 years ago.
4 years ago. Okay, can you tell me where did it start? Like at home, during your work?
Yeah, so I was usually at home.
Okay, so do you have any idea what caused it? Like, is there any kind of action that could have caused this?
I'm not really sure, but I get this pain a lot, you know. It's hard for me to work and carry on my usual duties because of this pain.
I'm really sorry to hear that. So just can you tell me how often do you feel that pain?
So it usually comes and goes,
Okay.
right? I get it about once every 2 weeks, and it stays on for about 36 to 72 hours.
Okay. Do you feel like the pain radiates somewhere else? Like, do you just feel it in your eye, or do you?
So the pain is on this side. It goes from here to the back.
Okay.
Yeah, on this side of the head in general.
Okay. Can you tell me what could alleviate the pain? Like, did you try to do any kind of movement with your head that could help with the pain?
Okay, so no movements. I tried taking ibuprofen, but it doesn't really remove the pain. It brings it down from a 7 maybe to like a 5, but that's it.
Okay. Can you tell me anything like, is it any kind of movement that could make it worse?
Not really, to be honest. Sometimes when I have like a stressful event or something's very loud, this pain comes on, but nothing that makes it worse while it's there.
Okay. From 1 to 10, could you tell me how painful it is? 0 being not painful, 10 incredibly painful.
Okay, so this pain, I would rate it a 7 out of 10 because it's usually very bad. It disrupts me from carrying on my usual activities. At its worst, it's about a 7 out of 10. Yeah, I would say.
Okay. So now, what do you expect out of me right now to help you with this? Is there any expectations?
To be honest, I just want the correct diagnosis so I can move on with my life.
Okay. So right now I'm gonna just ask you a couple of questions, and I'm gonna start with: do you smoke?
Not really, no.
Okay. Smoking could not just be the cigarette; it could be vaping.
I do shisha from time to time, like on a weekend, maybe once in a month, but that's it.
Okay. Now for the nutrition, could you describe your diet for me?
Home food, I cook myself.
Okay. So
About that.
would you say it's relatively healthy?
Yeah, I would say it's healthy.
Okay. What about alcohol consumption? Do you drink
I
occasionally?
do not drink alcohol, no.
Okay. What about your physical activity?
I am physical. I try to go to the gym 3 to 4 times a week.
Okay. And yeah, I would say that's it. No. So for the history, can you tell me anything about your medical history? Do you have any family history, any past procedures?
What do you want to know? I'm not sure. Like you asked like 6 questions
Yeah,
right now.
okay. So tell me about your medical history. Any past procedures?
Past procedures, like surgeries, you mean?
Yeah.
No, I've not had any surgeries performed.
Okay, what about medications?
Medications, I take the ibuprofen sometimes when the pain comes on, relieves it by just like 2 points, but not really that much, so nothing else.
Okay, what about your family history? Do you have any hereditary diseases?
Hereditary diseases? No, I don't.
Okay. Okay. So I would say, just to summarize what you said to me, so you told me you came today because you had this pain for the past 4 years. You told me it radiates or like you can feel it to the back of your head. You smoke shisha regularly. You exercise. You take ibuprofen from now and then to alleviate the pain,
Okay.
right? So will you say that that's enough? Do you have anything else to add?
That's it. That's it.
Okay. Okay, so I'm going to relay everything that you just said to me to my senior doctor. I really thank you for your time, and I really hope we can help you with this.
Okay.
Okay.
Thank you so much. Can I see what you wrote down? Okay, nice. Okay, mashallah, very brave. Good job. Appreciate you volunteering. But yeah, definitely. You got a voucher? Okay, before we go on to him, you guys heard the case, right? Okay, that guy said it, he gets a voucher. He said it first though.
Yeah.
Okay, what do you think you did well? Yeah. No, I wouldn't say that.
Okay, I would say I summarized well.
Uh-huh.
I would say also at the beginning, I introduced myself. I made sure to get his consent. I looked over the room,
Yeah.
asked him questions. I would say I did the social history well, and just a little bit of the subsidy.
Yeah. Okay, what do you think you could have improved on? Give me specifics. Okay?
Okay, let's start with the one that I noticed the most was, I would say, I was asking questions too quickly.
Okay.
Like, or asked multiple questions at a time.
Mm-hmm.
Okay, that happened at the end.
Okay.
And at the beginning, when I asked for the consent,
Yeah.
okay, and at the beginning, when I was asking for the consent, I felt like I was almost gonna say private questions. Can I ask you private questions? Of course, it's gonna, and it's not gonna take it that way.
Yeah.
Okay. And I also felt like I missed a lot of things at the first part, which is I wouldn't say the diagnosis, but the awqa. And at the eyes, I feel like I missed something there also.
Okay. I see. You guys think that's fair? Okay. I'll choose a person, and I want them to tell me what he did well and what he could have improved on. Okay. Who was here for the whole session? I know some people. Okay, go ahead. Yeah, tell me what he did well. Try to be loud because I don't want to go. One thing he did well.
He was confident, showed empathy and interest in the patient.
Mm-hmm. Okay, that's it. You in the middle. Yes. Good introduction, right? Amazing. Okay, last one. In the end.
A good thing.
Yeah, good thing.
He made sure like the patient is comfortable and take consent
Yeah, nice. I would say that as well. He was very confident, very brave, and he made me feel comfortable, right? He made me feel respected, okay? Because a lot of the times, you know, I've seen this in the hospitals. Patient comes in, doctor doesn't even greet them, doesn't even look at them. Just come and sit down. So he did that really well. No, he can build on that. Specifics that he could have improved on. Ahmed, one thing.
Ask multiple questions in one question.
Okay, he said that. Give me another thing.
I see. He only asked about what's the idea or what do you think the state was by. Concerns and expectations and
Okay,
the last year.
I see. One more thing.
He forgot to ask for his name, age, and occupation.
Yes, because of
Very important.
It happens to almost like all of us in your workplace.
Yeah, I'm telling
It's totally
you guys remember the rule of double threes, right? Memorize this thing like the back of... I don't think when I'm asking these questions, I have nothing in my head going on, I'm just trying to relax when I'm asking these questions. Because I have it memorized like the back of my hand. It helps you. So just try to do that if you're messing up a lot, okay? And I know it is hard because it's slightly long to memorize. What I noticed works really well when you're trying to memorize, and this is a very strong technique that they use in Quran memorization schools. They memorize through associations. So when you mess up once, when you forget something once, what you can do is go to the previous question, repeat that question, and then repeat this one right after it. So you associate the previous one to this one, and you will never forget it. I'm telling you, you will. If you treat each one as its own, each question as its own in the beginning, you will tend to forget a few things. But then if you treat it as one thing, one compilation of things, you're less likely to forget it, okay? It helped me a lot, not just in this, but in physical examinations and in many things in life. Memorize with associations, okay? One more thing you could have improved on, you in the middle. Yeah, no, the one in front. The one in front.
I wasn't there the whole time.
Okay, that's fine.
But I'm not sure about the summary. I feel like it had too many things.
Summary was okay. I would say he took a few pauses and he said a few things that he didn't really need to say because he was thinking back a lot, right? Which it would have helped him if he wrote it down. My experience. Like write it down really quickly. You want to say something? You want to criticize him really badly? Go on.
He said he's a junior doctor.
Okay. Yeah. This I sat down with him. Junior doctor. Are you a resident?
No, because you're a senior doctor.
No. Calm down. No. You're a year one medical student. That's what you are. Know your place. I'm kidding. I'm kidding. So, yeah. Listen, the advice I'll give you is you were going back and you kept trying to think, what should I ask instead of focusing on my symptoms. But the history that you took, a normal person would not have been able to compare this migraines versus cluster headaches versus tension headaches versus other stress headaches. Try to have the sequence memorized, right? So once you do that, okay, slight rant, okay? So you guys are in the beginning, right? You're step one. You have to memorize the questions really well, really well. Then you can get comfortable with it and you can kind of calm down, not be anxious about, oh, what I have to ask. I forgot the next question. I forgot to ask that previously. That's when you get comfortable. Then after that, in the next few semesters, you'll be able to add on to things. You know, you'll be able to actually actively think about the diagnosis and the questions that you have to ask specifically. In the OSCE, they don't want you to just be able to ask the questions. They want you to be on the next step, which is being comfortable. Make the patient feel comfortable. Not take so many pauses or fidget, which he was not doing. He was very comfortable, mashallah. Okay? You're not fidgeting, you were not moving back and forth, you were not like, This is things that they focus on. In my advice, okay, I would suggest you practice so much that you get comfortable. Not that you try to forget about the data gathering skills and just try to be comfortable. This is the advice that some people are giving because they change the grading criteria a little bit to where they judge you. I heard this somewhere that 70% of the grade is upon your verbal and non-verbal skills. So how comfortable you are and how comfortable you make the patient feel. But then this, as a human being, logical human being, you will not be able to do this once if you don't know what you're talking about. You don't know the question that you're asking, you know, you're just there like, oh, I forgot this and that and that. You will get nervous, you will have your heart beating fast, and that will lead to a sequence of events, which everything will go down the drain, okay? Practice, practice, practice. That's when you get better, you get comfortable, you make the patient feel comfortable. I feel like I'm going over time. We'll have one more scenario, okay? Who wants to volunteer? Thank you so much, appreciate your time, okay?
Next volunteer.
Okay.
One thing I wanted to add to the feedback is, in case you forgot and everyone forgets, they will expect you to forget. It's totally normal. As Samiullah said as well earlier, everyone forgets. But it's how you come back to it. You can use it instead of saying, oh, sorry, I forgot this, don't say this. Because now the doctor or the examiner knows that you've made a mistake and he knows that you kind of doubt yourself. So just say, oh yeah, now I'm going to ask you this, or try to put it in smoothly. So you can ask for example, if you forget about the age, once you get to the social history, you can ask about the age, the occupation, so on and so forth. Yes?
I just have a question. When we were practicing in that, there was one time I did it, I introduced myself immediately, like, hi, my name is etc. And then a prior scenario, I was like, hi, how are you, before starting everything. And then the doctor was like, you need to start with this. Like, I like this much better than just coming and saying, hi, my name is Aisha, etc. So, do we follow the same thing you guys said? Well, we have to like make the patient a bit comfortable, like as a regular person, not as a patient in the beginning.
It's better to always follow the order of the checklist. But again, you can do probably whatever you want as long as you're comfortable with it and the patient is comfortable with. So I think in the checklist they said you enter, you say good morning, hello, my name is Mustafa, for example, and then you go on. So what did you do exactly that they said was wrong?
No, it was like he said it's too fake or like too formal, and some people, like, for example, when they started, they came to the patient and were like, I like your outfit today, or like something to remove the
Break
official
the
stuff.
Yeah, as she said, break the ice. Yes, you can do this, of course. Again, it's if you have, for example, nothing to think about.
Don't overdo it, okay? You know why you're there, the examiner knows why you're there. Your goal is to make them comfortable and be comfortable. You can maybe in real life, but don't overdo it. That's my advice.
Yeah, it's best to just follow the checklist. So,
You have the checklist, you have the scenario.
yes,
Hello, good afternoon. My name is Raghat Jafar. I'm a first-year medical student. I've been assigned by my senior doctor to ask you some questions. Are you okay with that? Do you feel that the room is comfortable enough for you? Okay. And I'll ask you some questions. It may be sensitive for you. Are you okay with that too? Okay. What's your good name?
my name is Jafar.
Jafar. Okay. Nice to meet you, Jafar. How old are you?
34.
4 years old. What do you do for work?
I'm an IT specialist.
IT specialist. That's very nice. What brings you here?
I have something on my wrist for the past few weeks, maybe.
Weeks? Do you know exactly when?
About 6 weeks.
About 6 weeks, okay. What were you doing when it started?
I don't really know.
You don't remember, that's fine. Did the pain change? Did you notice anything change from the pain?
Well, it started off as tingling, just normal discomfort, but then it became so much worse, it turned into pain later on.
Okay, so it turned into pain. Is it sudden? Did it start? You said when you mentioned it became worse. So the pain started suddenly or gradually?
No, gradually.
Gradually, okay. Is the pain constant or does it come and go?
No, it comes and goes.
It comes and goes. How often does it come and go?
Say, for example, maybe 2-3 times a day.
2-3 times a day. Okay. how much time is each episode of the pain?
About 10 minutes.
About
It's
10
for
minutes.
about 10 minutes.
Okay. Can you point exactly where is the pain?
So it's right around here.
Okay, is it like one spot or does it spread?
Well, it spreads all over. Sometimes it spreads to my thumb, sometimes to my two fingers here.
Okay. Did you notice anything makes it better?
Just general rest. I tried some painkillers. They did work for a while, but at some point they just stopped working.
Okay. Did you notice anything makes it worse?
Yes, when I use it, because I'm an IT specialist due to the nature of my work, I have to use the mouse a lot. So whenever I use it for a long time, it starts hurting. Also, even sometimes recently, for the past 3-4 days, even when I drink water, it starts hurting.
It starts hurting. Okay. I'm sorry. Perfect. Is there any other symptoms that happens alongside with the pain in your wrist?
What do you mean? What?
Redness,
Yes, there is
some redness, swelling.
Yes.
Can you move it?
I can move it, but it hurts when I do
It
it.
hurts. I see that. Do you have any idea what may cause this pain?
It's probably due to the long hours of work with the mouse. I think it's that.
I see that. Do you have any certain concerns towards it?
I'm just concerned that I'm not going to be able to do my work properly with it.
Okay, I see that. Do you have any certain expectations to, aside from the treatment?
No.
No? Okay. Did it affect your life? You mentioned that it affected your work. Anything else?
Yeah, as I mentioned, I cannot even drink water properly anymore. I cannot move my hand, for example, whenever I open a door, it hurts. It hurts a lot.
Okay, to ensure a proper examination for you, I will ask you some background information. Have you experienced something like that before?
No, this is the first time.
Okay, do you have any long-term illness that you go to a doctor for?
I do have high blood sugar.
You have high blood sugar. Do you take any medications for it?
Yeah, I do take insulin.
Other medications? Do you have any allergy from medication or food?
I do have an allergy for penicillin.
Penicillin?
That's about it.
Okay. Did you do any surgery before?
No.
Okay, now I will ask you some questions about your habits. Do you smoke?
No.
Have you smoked before or no? Do you drink alcohol?
No.
Do you do any physical activity?
Yes, I do play sometimes with my friends table tennis. About maybe 3 times a week.
Do you? Can you describe your diet for me, please?
It's just fast food most of the time. I'm working at my work. I cannot always make food at home, so I get fast food.
Okay, I see that. Okay, Mr. Jafar, I know you have wrist pain, and you said that there's redness, and it's not only in the thumb, in the wrist. I mean, it extends to the fingers, and you work as an IT. You work as an IT specialist, and it affected your life. Is that accurate?
Yes.
Do you want to add anything else? Okay, I will relay this information to my senior doctor. Thank you so much, Mr. Jafar.
You did really well. Really well, I think. But you tell us first.
I feel it was good. I did not show really empathy. I was kind of direct. Questions and answers, that's all.
Okay, I feel like that's because you are still getting used to the checklist, right?
Yeah.
You don't have time to be comfortable. Once you know the checklist, you're more comfortable, you can think of all of these things. So these don't come the first time you're doing the history take. This is very natural. Okay? So I would say you covered that pretty well, in my opinion. Okay? What else?
What do you think could have been? What do you think you did really well?
I kind of covered most of the checklist, as I can see. Don't know.
Okay.
What do you think you could have improved on?
Maybe getting the questions out naturally. Yeah.
What do you think you need to do to do that?
Practice.
Practice. Right. Practice.
You did great.
Before that, I just want one. What did she do well? Very quickly.
The checklist she did.
Yeah. Right. Okay. What could she improve on? One thing specific.
She forgot, I think.
That's it, right? Nothing? One comment from anyone she could improve on. Yes.
There's just one thing she missed, aside from like the quality. At the beginning, you didn't mention the confidentiality. That like, the information remains between you and us.
Yeah. Memorize. Memorize. I don't know why people like they trip up on this or like I forgot this and I forgot that. No, just memorize this thing because you'll be asking this. I think I've asked it at least a good 500 times at this point. I'm not even kidding. 500 points. 500 times. So these things memorized by association. You know, try to. Me personally, the way I memorize it, I'm like, imagine the patient's not there, and I'm just going back on myself. You know, and then I add the natural pauses of where the patient has to. Because once you memorize it in this way, you'll never forget it. Okay, that's my advice. Take it or leave it. Okay.
Also forgot quality and quantity.
I think he did not ask about the quality.
Yeah, and quantity.
Okay. Well, good job in general. Well, yeah. You deserve this. Okay.
Feedback.
Okay.
Please,
Scan this. We'd love your feedback. Please just write something. Okay. Done? I want questions. Okay? What do you guys think is not clear? What do you guys think? Yes, go ahead.
Because I missed this summary part. Can you just go over how like a perfect summary would
Okay. Let's do the ground. The case that I did, okay? Okay. So just to summarize, Mr. Tony, you came in with a 6-week history of pain in your right big toe. You said that you rated the pain kaza out of kaza. I kind of forgot. And you said that it doesn't get better with anything. You said that it is also associated with redness. There's warmth and then there's some swelling. And you find it hard to move. You said that it comes on or the pain gets worse at night. You said that she didn't take medications, right? Medications. He did, right? So you take this and it improves or it does not improve it, right? At your stage, you technically don't have important negatives because you don't know what important negatives are, right? You guys are taking introduction. When you move on, you go to semester 2, you go to year 2, you go to year 3, you will know exactly what important negatives are because those are the things that you want to keep in mind and you want to summarize. But for now, whatever the patient said, you could memorize really fast and you think is correlated to the case, you say it. All the associated symptoms, you cannot place associated symptoms. Recap when the pain got better and when it got worse. Okay? If the patient has been smoking for a really long time, mention that. The patient has other comorbidities like hypertension, diabetes, mention that. If they're on medications, mention that. Other than that, you don't need important negatives because you guys don't know important negatives. Okay? Yes, go ahead.
So for the day-to-day, now my clinical classes, it was never mentioned you could have a meeting of it.
You will have it. You will have it. Okay? It's there in every single ask. You will have it. A lot of people don't use it, right? Then a lot of people use it. It's a funny case that happened, but I don't think it's appropriate for me to even tell it here because it's illegal. But yeah, there's a bunch of things you can do with the paper, and it's very useful. It's very useful. Okay, write down the name. Very important. You cannot forget that. And I personally like just writing down numbers. Okay, so his age, right? How long he's had the symptom? Because at the end of the day, you'll have to summarize it again. You can't mistake that. So sometimes you just write abbreviatives for associated symptoms. No nausea, vomiting, N/V, cut it out. Stuff like that, stuff that helps you. They don't really care about what you write. But don't spend too long writing and so on. Yes?
For example, in your scenario, the onset was it started 4 years ago.
Yeah.
Is it appropriate to ask him like what made him come now instead of any time?
Yeah, you should ask that. You should ask that. I didn't. I don't think I asked that. You should ask that. Very good. Because sometimes there are very chronic conditions like COPD and asthma. When they have exacerbations right now, it changes the management. It changes management. So it is very important to ask that. Other questions? Yes. Okay, so we kind of went over it, but there's multiple spots that you can go over. You can show empathy. I told them a scenario about how I did something for 3 years and showed empathy in the wrong spot, but never got caught. But usually you can show it where they tell you ask them to how bad is your pain. They say something, you're like, that must be hard to deal with. I'm so sorry to hear. Or when they say my parents passed away, you're like, I'm sorry to hear that. So on, like that. Yeah, it can help you with treatment. Questions? Yes.
Yeah, during the ice section, if because in one of the scenarios I had in the clinical skills lab, the patient said that they searched online and they thought it was this disease or this issue. How do I reply to that? Because I'm not really supposed to make a diagnosis.
Yeah, I get you. So this is not something that's on your level, but when patient comes in well researched, you're not supposed to slight bit rant, but I'll come back to it. You're not supposed to downplay that, right? And let's say patient says, I have this pain over here in my lung. My great uncle had some sort of cancer. I'm scared it's that. I googled it and they're very similar symptoms. How you're supposed to respond to that? It's not really at your level, but you try to tell them, okay, inshallah, no, we will look at our investigations and let you know, right? Because you can't really tell them that it's not going to be because you don't know. So you'll tell them, before you get out of here, inshallah, you will know whether you have it or not. But most probably no, right? If their symptoms are very unrelated, you can kind of give them a hint here, but usually not supposed to. I get the point that you're still year 1, semester 1, and I'm surprised that they gave you this. So you're not supposed to be dealing with this, because you're not supposed to give advice. I'm not supposed to give advice. Interns are not supposed to give advice. Not supposed to give diagnosis.
The doctor said don't give advice.
Yeah,
Not supposed to.
it's not supposed to. Just tell them that you will be sure if it is this or it is not this once we're done with our investigation, so you don't have to worry. Don't have to worry now. Okay? Questions? No more questions? You guys filled in feedback? Okay. When is your exam? You're asking? November, right? How many days are you going to give it to study? 1 day for practice of history taking. Do you think that's enough? Okay, this exam, it's what me and my friends call the Marks farm, because it's so easy, right? But then the grading criteria has changed. You understand that, right? They judge you based on how comfortable you are and how comfortable you have the patient feel. That comes with practice. If you think with 1 day of practice you can nail it down.
It's either that or last thing exam.
No, I understand that, but you have around 16 hours a day that you're awake. And come on, 10 to 30 minutes, just one scenario with your friend, and then your scenario with, he does a scenario with you. So once a day, maybe do it for 3-4 days. So practice makes perfect, you'll be comfortable. I suggest you practice it a bunch of times because it's your first time taking the history taking. You cannot lose marks on this, man. I would be disappointed in you if you lose marks in this. Because it's so easy, but it needs practice. You don't need to be smart, you don't need to study anything, just practice. Okay? And have your friends give you feedback.
Yeah, it's best to have, I think, 3 in a group. So one patient, one doctor, and then one writes down everything as feedback.
Yeah.
That's the best.
Okay? Will you give it more days? Okay. Sorry to put you on the spot. I think that is that you guys have blood pressure, right? You guys have blood pressure, they have blood pressure as well, right? They don't have blood pressure. Okay, Khas, you go in, you ask questions, and you're out. So nice.
Muscular injections.
They're taking it tomorrow,
They have intramuscular injection. Wow.
Tomorrow.
yeah. They're taking it tomorrow.
Did they tell you the layout of the OSCE? Like, do you guys have 1 station or 2 stations? It's weird, you know?
Listen, here's the thing. When we were talking to your doctors, everything related to the exam, they will relay it to you because it's still not finalized. Don't worry. Once we see it's out, we can clarify. You guys can ask any one of us your questions. Whatever you like. As an exam details, this
Okay. If they tell you that there's 2 stations and you have only history taking and intramuscular injections, then you know both of them are coming. Okay? I suggest you go practice. You look over the equipment. What gauge is each needle? The technique. How am I supposed to insert it? What am I supposed to do with this equipment? How am I supposed to sanitize? Practice that at least once or twice and you'll have it down, okay? That's it? Right? Okay, we have, if you guys are not dying to leave, we have this fun scenario where me and him will act out a scenario and we'll make a bunch of mistakes. I want you guys to note down every single mistake that we make and we'll ask you. Okay? We'll give you, for every person that, how many vouchers do you have? We have 5. Yeah, we'll give everyone rewards. That gives us at least one good one. Okay? How's that? I'm very excited, I can see. Okay. You want to take yours? No? You're the doctor. Okay. What do you eat? Yeah, fuck.
What one?
Question. Before, let's say that you are talking with the patient and you missed something or you spelled something incorrectly. Should you apologize to the patient, like you say, I'm sorry, and then you continue on? Thank you. Let's say for the age, instead of saying 43, you misunderstood us as 34. And you told the patient.
Okay. And you remembered it right after you said it?
Yeah. Or he corrected you.
Or he corrected you, right?
Yes.
Once you passed, that means you finished your
Yes.
taking.
Or in the middle. Does it like be different?
In the middle, he stops you and he says, "You got it wrong, buddy." You do apologize, but you're not apologizing to the patient. You're apologizing to the examiner, right? Like,
No, even for the patient. Do we? Should we apologize? Or just accept it? Yeah, I'm sorry.
no, you do apologize. You're like, "Okay, I'm sorry. I meant this," and move on. Don't try not to let this frustrate you. Some examiners, and I'm not even kidding, they're bored. They're literally there the whole day, and they want to mess with you, even though they give you good marks. But they're like, "How do I mess with these people?" Because what you have is very easy. So don't let it fluster you. You have something like minor come up like this. Don't overthink it. "Oh, I'm sorry, I meant 43. Oh, I wrote down I have bad handwriting." Just move on with life. Don't let it fluster you, okay?
Basically, be smooth with it.
Be smooth with it. If they don't even bring it up, chances are they didn't remember that you forgot the age. The examiner. Oh. Yes.
Let's say you're going through the checklist and you forgot something, and then you remembered it later on.
Okay.
Can you say like, "Oh, sorry, I'm going to take you back a little bit," and then say that, or do you just forget about it and continue with the checklist?
No, why would you forget about it? If it's something that's important, you think you try to bring it back. Let's say you forgot an associated symptom, and you're all the way in medical history. You're like, Okay, actually I forgot to ask you if you had any headaches. If you had any, to confirm if you had any this, go back to it. You have to go back to it. You cannot miss it. You miss it, you lose the mark. They have a scenario. They judge you based on how much of it you asked. Okay? Don't move on with this.
Yeah, again. Yeah.
Small note, don't say I forgot. If you remember it, say it. Ask it على طول. Like keep going. Do not let it, as Samiullah said, do not let it frustrate you. If you remember it, say it, keep going.
Yeah, they give you the full mark by the way for this. So if you're like, oh, I forgot, I have to go back, the examiner is going to mark me because no, you get the full mark for this. Once you forget.
So it's okay to not stick to the arrangement of questions and
This will mess you up. This will mess you up.
Okay, but I forgot one question, then I will ask it again. So it's okay if it wasn't.
Yeah,
in
if you
the
make
original.
1 or 2 mistakes and then you ask it in the end, that's fine. But then, let's say you end up forgetting 7. Are you gonna remember all of them and go by this? No. That's why I want you to practice. Get me? But again, you will not lose anything if you go back to it. There is a mark for how structured your history taking is, but again, we don't have your checklist. So for us, it is there that you go in a structured way. You can't ask the patient's name in the end, right? Because that's, come on. So when there are things that obvious, but there are things that are completely benign or that don't really matter. If you forgot to ask something in the associated symptoms and then you ask it in the review of symptoms, that's completely fine. Or if you bring something up back, like a symptom that you forgot that you think is very relevant, you ask it, that's completely fine. But then if you mess up the whole checklist here and there, like you remember the picture that I showed you where the guy went like this and like this and like this, you will miss the mark. You will definitely miss some marks. Okay, and then you'll also be flustered yourself. You're like, forgot to ask this. So it's try to practice. That's my advice. Okay.
You can, for example, if you forget, just one other thing, if you forget a question, you can find any other place in the checklist that looks kind of like it and ask it there. So for example, you forgot to ask about alleviating and aggravating. Once you're done with the what can be part, you go into, for example, medical history, you go to the medications, you ask him there, did you use any medications? Don't tell him that you forgot. But if you remember, just ask him, did you use any medications for this? Did you do anything else to try and make it better? Did you try anything to make it worse? And then ask about the overall medications and long-standing diseases. So try to make it look as if you're confident. And yes, you made a mistake, but as if you made it purposely. Yes, you had a question.
There's one time we did like a lab activity, but it was not in a case. So the patient came, he had like a bad experience with the hospital, and they were asking us what do we want to say. So my answer was like, we care a lot about the patient, we try to fix it, and the doctor was like, no, the patient don't want to hear that. So if it comes in a case like what we're supposed to say.
So what did the doctor ask you to say? You forgot.
They first told us to show empathy, say apologize, say that we're gonna try to do our best, and you also asked them what specifically bothered them at that time.
Very smart. Yeah.
And one more very important point: you cannot say, "Oh, we're better than them. That hospital is not good." It's a red flag. That's what.
Of course.
Yeah.
But be normal,
it's
bro.
the same hospital. He came back. Like,
Yeah.
Oh yeah, or something about your colleagues. Say, "Oh, he's not the best doctor. He's a new doctor." It's like a red flag that the doctor mentioned. Because
Be natural with it. Be smooth. Be like, I'm sorry to hear that you had such a bad experience. We'll try to make things right. We'll try to do this and this right. Can you tell me what it was specifically that bothered you? We'll try our best not to do that now. You know, peaceful. How would you have a normal conversation if you were a doctor and the patient said this to you, right?
But when I said that, I said like the patient doesn't want to hear that.
Hear what?
No, I think you said. Like,
Don't
I'm
ask
sorry, I'm trying to-
don't ask about the experience and exactly what happened.
Oh, exactly what bothered you?
Yeah, no, hey, he doesn't want to discuss about that. Just
Oh, weird rules, but sure. Do as a. I really doubt that they'll bring this in the exam.
Very
I
complicated
I seriously doubt that. Again, some doctors are bored and they just wanna throw something at you. You know, they're not marked with it. You know, I know cases where people came out of the OSCE exam. They were like, the doctor asked me about the diagnosis of hypertension. If they were hypertension. No, no. This is year 5 family medicine, bro. They're just messing with you. there will be like 10, this will be like 5% of the cases, because sometimes hospital doctors come in, you know, they're bored. But majority of them, if it's F2s, they know exactly what you know and exactly how you're feeling, so they will not mess with you. Inshallah. Okay? My main point is, don't get flustered whatever they ask. Be natural. And this only comes when you practice your own checklist very well. So you know what you have to know, what you don't have to know. Okay? Yes.
It's a very stupid question, because has it ever happened to you that in the start when you ask the patient, oh, I'm gonna ask you some questions, if they say no, like...
Listen, this okay.
Does that ever happen?
First of all, I don't know why everybody was starting with, I'm going to ask you a few questions that might be a bit sensitive. Like, is it something new that they were teaching?
I met when you were in school, and you're like, I've been assigned to ask you some questions. Is that fine?
Don't say personal sensitive questions. Say I'm gonna ask you a few questions about your personal habits. That's it.
No, and this is at the end, like when you're asking about social history. When they come in, my doctor sent me to take your medical history / to ask you a few questions / ask you a few questions about your medical history, depending on the vibe that the patient gave, how much they understand English, and whether they would understand the word medical history or not, you know. So you can kind of, but you don't have to.
What brought you in today?
No, this is, I'm talking about consent. So you're asking consent, you know.
Talking about the consent part.
Yes.
They say no. What do you do?
They
would never say no.
Listen, there's a reason they came to the hospital. There's a reason that you're there in the exam. Khalas, thank you, bro. I'm going out. Bye.
Okay.
Of course not. Don't be worried about things like this. Worry about the things that you know will come. Okay? Don't. Yes.
So let's say the doctor is just bored and he's trying to ask me a question that I'm not sure with, and the diagnosis. Do I say I'm not sure? Do I just tell him?
I will refer back to my senior doctor and get back to you. Memorize this.
Also, you won't be asked about diagnosis in this.
Yeah.
Don't worry.
This was something that we asked someone this in the blood pressure station, which you guys don't have, Aslan. Okay? Patient blood pressure is high. Do you diagnose him now? Medications do you give him? This was a year 1 semester 1 student.
Don't worry,
But-
this is an exception to the rule.
Yeah, exception to the rule. Again, this is my point. The reason I'm telling you this is not to make you wait. I'm just telling you that there will be a 1 out of 10% chance that something like this happens, but know that this will not affect your mark or what the doctor thinks of you, because they know what level you are at. Okay? Don't let it fluster you. Be smooth with it. Okay?
Also, I did ask the F2 doctors. They said that they're not going to bring anything too out of the ordinary. Most of the cases that are going to come in the exam are almost similar, if not identical, to the ones you had in the labs.
Also, I think people are asking, like, I'm gonna ask you a specific question, because when you were practicing, there was like the lifestyle question where you asked, like, do you smoke? I said that, like, do you smoke? Just like that was like, no, you have to say, can I ask you a sensitive question and then ask about alcohol?
Listen, I wouldn't, me personally, I wouldn't even go into saying sensitive, because it worries the patient. Tell him. Exactly. I just want to ask you a few questions about your social habits, about your lifestyle habits, and ask, okay? Because this question, sensitive stuff, it comes in year 3s when you're going more over the STIs and so on. You can't, if you're suspecting something like that, you can, but of course this is not your level. You should not say the word sensitive, okay? Ask you a few questions about your social history, about your lifestyle habits. That's it, okay?
So just before we start, I think I just need to mention one more thing. In the medical history, it's like a minefield, because you have to ask the patient about some diseases. So for example, hypertension, atherosclerosis. But again, you should never use jargon. Especially in this part, try as much as possible to minimize the medical words. Use high blood pressure, use high blood sugar, use high cholesterol, things like that. So now we're going to start the case. You're going to find the mistakes that I make during the scenario.
Guys, diagnosis gets a voucher, okay? Diagnosis gets a voucher.
Assalamu alaikum. My name is Mustafa. I'm a second year medical student. I'm sent here by my senior doctor to ask you some questions. Is that okay with you?
Yes.
Is the room part enough for you?
Yes.
I'd like to ensure that everything that's going to happen is going to stay between you, me, and my senior doctor.
Tiny pause. Guys, just remember, this is the scenario where you have to criticize him, okay? So he'll be making mistakes intentionally, and you have to pick up on that. So keep that in mind, okay? Okay.
Okay, so what's your name?
My name is Ahmed.
Okay, Mr. Ahmed, what brings you here today?
So I've had this headache that came on about 3 days ago.
3 days ago, okay. And since those 3 days, was it continuous or was it on and off
So it has been continuous, I just stayed there.
for the last 3 days?
Yeah.
And during those 3 days, did it become better or worse?
It's just been getting worse, to be honest.
So much worse. Okay, I'm sorry to hear this. Inshallah, we'll work towards helping you. So about this pain, can you tell me what you remember you were doing when this pain started?
So, not really. I came back from Nigeria like a day ago, and I came here and I started feeling this headache. So nothing specific.
Okay. And can you tell me where this pain exactly is?
Here.
Okay. And about this pain, does it move anywhere?
So it kind of is in my neck, you know. I find it hard to like move my neck a little bit. I wouldn't say it's painful, but when I move my neck, that's when I feel pain.
So it's mainly in the head, maybe the top side, and then it goes to the neck.
Yeah, it goes to the neck.
And about the, can you describe this pain for me? So for example, is it maybe throbbing pain? Is it crushing pain?
It's like a dull, aching pain, you know.
Oh, it's dull, okay. And can you rate this pain from 1 to 10?
So the pain itself, I would give around 6 out of 10.
6, okay. No, inshallah, we'll work towards making this better. Did you try anything maybe to make this better?
Not really, to be honest. I tried taking Panadol, but it didn't help that much, to be honest.
What about worse?
Again, when I move my neck, you know, the pain in my neck gets worse.
And I'm going to ask you a few questions, maybe about your some other symptoms. Did you have, for example, any joint pain during this time, those 3 days?
Just my neck.
Just the neck, okay. Did you have, for example, any fever?
I do have fever. It started around the same time as the headache.
Or did you have maybe any gastric problems?
Gastric problems? Not really, no.
No? Okay. So now I'm going to ask you a few questions. Maybe what do you think caused this disease?
I think I maybe got something from Nigeria when I went there. I came here and it started acting up.
How long was the traveling for?
I went there for about 2 weeks.
And okay, so the ice, yeah. What concerns you about this pain?
I don't know, it's just not going away. I feel like it's something serious maybe.
So you're concerned maybe it becomes something like so much worse.
Yeah.
And what do you think this has an effect on your life?
Yeah, I'm just not. I can't work the way that I used to. You know, I can't lift the heavy bottles that I'm usually lifting for my work. So.
And what are your expectations from us aside from treatment?
I need a sick leave and just a correct diagnosis, please.
Okay, we'll help you with that, inshallah. So I'm going to ask you a few questions about your overall body health. If you find anything that you have, please do stop me. It's going to be rapid fire questions. So do you have maybe any problems with your feet when walking? Maybe any joint problems, any visual disturbances?
I do sometimes feel like flashes in my eyes, but that's it, to be honest, nothing else.
And what about maybe problems with your bowel movement? Is there any problems with that?
No.
Any problems urinating?
No.
No? Okay. So yeah, This is the first part. We're gonna stop for now, and then we're gonna get back with the history. So if anyone has any feedback.
Wait. Diagnosis. Meningitis. How did you guys even know?
Who guessed it? Who guessed it? What did they say?
Meningitis.
Really?
Yeah, nice.
Did
Did they study it?
you guys study it?
I saw this guy looking it up on his phone. Yeah. Wow. Okay. I thought he was looking it up. I smelled it. Nice, good job. Okay, feedback time now. Yes, you have it written down? Okay.
I think he missed the age and occupation. Like he asked the name and then started.
He gets a voucher. Okay. Who else? Your friend already got one. The one behind you.
The rapid fire question, like most of the things was not answered by the patient.
Okay. I have a comment about this. When it's associated symptoms, you can't ask multiple questions at once. This was technically not multiple questions. It was one that was, do you have muscle pain or bone pain? That's one question. That's not two questions. But you cannot ask this in the associated symptoms. If you suspect bone pain or muscle pain, you have to ask separately. But in review of symptoms, when you're just trying to get through your list, you can kind of go. This is a tip that Dr. Ali gave us, because we have segments like rapid fire, group symptoms together, so you don't get a voucher. I'm sorry. Nice try though. At your level, I would have said the same thing. Go. Yes. Yeah.
Yes.
Okay. She gets a voucher.
I actually wanted to do this throughout the history, so you can see if anyone would notice. But mashallah, you go.
Nice. Yes.
I think he repeated many questions.
Be specific.
Like he asked about the bowel movement more than one time, and he asked about the elevating and aggravating of pain again at the end.
Okay. I'll give it to you for the bowel factor, bowel problems. But alleviating, aggravating, you kind of have to mention it and then ask again because you have to be specific, especially for you guys in the checklist. Because even if I mention it, right, that this pain kind of goes here and then I move it, and they will not give you the mark that because just because I said it, I'm just going to take it off. You have to still specifically ask, is there anything that makes the pain worse? Because my main complaint was not the neck pain, it was the headache. So you could technically be asking about the headache, right?
Yes.
Okay. But nice one. You still get a voucher for the bowel movements.
We have 6 in total.
Okay, we have 3 gone, right?
Yeah.
You already got one. You.
Pauses, you get like pause multiple times. You stop there and then
There were a good amount of pauses. I will give you that, right?
also he did mention like a bit of jargon.
Yes, jargon. I'll give it to you for jargon because jargon was a big one. Pauses. You can't have it, right? You want to be comfortable. You want to make the patient feel like that you're confident. But again, you're human. Sometimes, I would rather you say have a pause than go like, so pause is better. But again, practice so you don't get to that point. Okay? Well, I'll give it to you for the jargon. That was it. Sorry. That was all the vouchers, but still go on for the feedback. Yes.
He forgot to explain the spin scale.
Yes. Exactly. Go ahead.
Yes, when he asked you to explain description of the villain, he gave you the examples so you keep it focused.
Yeah, he has to ask a big question first. Nice. What?
The summary or the lifestyle or like.
This is at the end. We posted, so just one person.
Yes.
So I know that he said, I'm sorry, I'm gonna solve this problem for you. I feel like he said the same sentence twice.
Yeah, it was like he was trying too much.
Yeah, we're just trying to, it's like a robot, just gonna say the same repetitive response.
Yeah, it shouldn't be a reflex, For me, it was, but I told you this was a mistake and it shouldn't be like this. Empathy, sometimes if you get a F2 doctor, that's like, they have a scale for every comment that you have, so how confident was the student in his questions, and they don't just have like a tick or no tick. they have like a scale, and then sometimes they're like 3 out of 4. So, yeah. Okay.
At the end, he said, like he asked the questions about the bowel movement and the urination. Isn't that relevant?
It's the
Review of symptoms, you can technically ask almost anything.
That's one thing about the review of symptoms. Yes, you want to say something?
Privacy. He didn't ask if the room was private, you know.
A rule of double threes, please memorize it. Wallah help me out a lot. Any other questions? Feedback.
Okay, one thing about one thing about the review of symptoms is that I went in a random order. It should be superiorly to inferiorly.
Yeah, constitutional symptoms first, but again, you guys don't have to deal with this. Just memorize weight loss, change in appetite, fever, fatigue. Oh, it should be good.
Yes. So now moving on to the medical history. Did you have any recent hospitalizations?
No.
No? Did you have any surgeries in the past?
I had like an appendix, right? And there was a problem with it, and I had it removed like about 10 years ago.
Okay, and do you have any long-standing diseases?
No.
Maybe atherosclerosis, maybe hypertension? Nothing?
Nothing.
Okay. Do you have any allergies to food or medications?
No allergies.
Do you have any medications that you take?
No, I don't take anything. I tried taking Panadol for this, but it didn't really work that much. I got down a fever sometimes, but then it would come back.
So now I'm going to ask you a few questions about your family history. Are your parents alive right now?
No.
No? Okay. How can I ask how they died and how old?
My mother was 67. She passed away of a heart attack, and my father was about 70, and he passed away from a stroke.
I'm sorry to hear this. My condolences. And did they ever have problems like yours?
No, they didn't.
Did your siblings maybe have a similar problem?
No, none of them. They're all fine. I don't have many siblings.
Okay. And did your parents have any medications for the problems they had?
No. My dad took this pill for his blood pressure, but I don't know what it was.
So now I'm going to ask you some questions about your private life. Do you smoke?
No, I don't smoke.
What about your diet? Can you describe it for me?
We have a cook in our labor camp, and then they make whatever we eat.
Okay. And what about your alcohol? Do you drink alcohol?
I don't drink alcohol.
Okay. What about physical activity?
I play football once every 2 weeks with friends, maybe. That's it. Nothing else.
And do you experience any stress, maybe in your work life or in your marital life?
Not really. I'm not married.
Okay. So now I'm going to go over your problems. So you came in with headache and neck pain. It was there for how long again?
6 days.
3 days.
He said 2 weeks. 2 weeks. Yeah.
2 weeks. So you've had this pain for 2 weeks.
Yeah.
Your parents they did not have a similar problem. You are a non-smoker. You do not drink alcohol. You exercise regularly. Did I miss anything?
I think you got everything correct.
Okay. So I'm going to get back to my senior doctor, and we're going to get back to you with the treatment plan. Thank you. Yeah, so what do you think I missed or did wrong during that? Yes.
I don't know how relevant this is. Just when he asked about the surgery, like I remember it was written to ask if there was any complications in the surgery.
Exactly.
Awesome. We got a case scenario in year 2, where sorry, I'm going on for. Make it very quick. The patient had small bowel obstruction, and then the only hint that they gave us was that the patient had an appendectomy about 10 years ago. And the problem with that is sometimes it was uncomplicated, but you keep it in mind. You do ask for complications because sometimes there's adhesions, and that adhesion cause So sometimes it can be related, majority of times for you to not be. So ask for complications, sure, but majority of times for your sake, they'll not be there. Okay? But yeah, good that you caught on.
By the way, I did not ask, part of my plan was not to ask anything about the surgery, but SamiuIlah, he went on about the surgery, the length, how long ago it was. Again, you can also ask about how long the hospital stay was. I don't think we covered this in any scenario or in the presentation. Yeah, what else? Yes. As usually, the usual answer is yes. That's yeah. I guess did I not wait? I think I waited one. I did not. Oh, so okay. We'll give you that demo. Any other problems? Yes.
Asking about if your siblings have any kind of problem. Let me ask him this: does he have siblings?
If he does.
You're asking if he has
Siblings, yeah, but you can ask it in this place. It's fine. It's not really a problem. He can tell you during this answer that I do not have siblings. Yes.
Yeah, when you talked about his parents, like immediately after he said they weren't alive, you didn't like say, yeah, you said in the end my condolences, but then you just said immediately, yeah, when did they die or how did they die and how old? Like
Yes.
there wasn't my condolences in the middle.
Yeah, exactly. I should have said it right away. Yes.
Oh, you want to know as well?
No.
Then?
She wants to ask.
I would ask.
Okay.
Okay.
When he said he does not smoke, he didn't ask him if he ever smoked.
Yes.
Yeah.
That is
That's
also
very good.
one thing. Yes.
What about the parents question when you asked about the parents? And even after he told you you didn't show any empathy, you just moved on, you said, okay. And then you moved on.
Yes. Someone like.
You guys think this is stupid? I have seen people do this in the hospital in front of real patients. I've seen people do this. It is. There's a reason they have these rules. Like, eventually they should have just told you be normal. But again, people don't know what normal is.
Yeah, so you should always ask about, ask it nicely, how are your parents doing? Don't ask right away if they're alive or dead. Of course, this might cause some problems. If they died really recently, it will be even worse for them. They might even take it sensitively. So ask how their parents are, and then if they are, la samhallah, dead, he's going to tell you, yeah, my parents died, actually, they're not alive still. So any other problems? Just okay, go.
At the end, you said, did I miss anything? That usually does not show confidence. Try to say, would you like to add anything? When you say the summary, Ahsan, say, would you like me to add anything to what I said? Ashan, your confidence when you're talking to the patient.
Thank you. Yes.
In the summary, I don't know whether it was intentional or not, but he said he rarely exercises, but you said he regularly exercises.
Yeah, I did not say that. I said I play football once every 2 weeks.
2 weeks.
Yeah.
And he said he regularly exercises.
It's regular once every month.
Yeah, once every 2 weeks is regular. Okay, this is why I really suggest writing down numbers. Numbers are so hard to forget. They're so easy to forget. It's easier to forget than the associated symptoms because once you know that you have a diagnosis in mind, you can kind of correlate like, okay, A, B, C, D, but then you forget the numbers.
Yeah, you also forgot the onset.
The onset? Yes. Yes, I did. Any other problems? Yes.
The last you said go and then to my senior doctor and you will get the treatment plan. Would it be like I will just move the information to my senior plan?
Yes, this is a better version of it. I don't think it would make so much a difference. But you are correct that the most correct way to say it is I'm going to get to my senior doctor and we'll get back to you soon, inshallah. That's the best way to say it. Yeah. So thank you, everyone. This was our clinical skills. Inshallah, you benefited the most out of it. And we'll see you in the OSCE. Get the highest marks, inshallah.